Welcome back to the Founder Series. I'm Dr. Rebecca Hertel, and I'm so glad you're here with me today. The show is where we get real about what it means to build, to lead, and to live, and all of those at the same time. And each week, I take you inside 3 layers of this journey. The Founder's Journal, where I share what's happening behind the scenes. The Midlife Minute, where we get practical about women's health and midlife wellness. And then we head into the lab, where we unpack the science behind it all, or whatever it is that I happen to have up on my tabby tabs for the week. So today's episode is about something I know so many of us are feeling right now, that constant juggle between ambition and overwhelm. And whether you're running a business, a department, a classroom, or a household, that feeling of being pulled in a dozen directions is real. And over the last several weeks, I've been in a season of rapid growth, speaking at conferences, webinars, traveling for events, connecting with amazing women, and trying to stay grounded in between and still being present for my family as well and my patients when I come back to work. So I've learned that growth isn't just about doing more. It's about learning how to manage your energy, your focus, and your boundaries. And so today in the Founder's Journal, I'll open up about the real side of that journey, what it looks like to come home after travel, to show up for family and patients, and to keep building a vision without losing yourself in that process. Then in the Midlife Minute, we're going to talk about something that ties directly into all of this, the science of burnout, its menopause awareness and breast cancer awareness. We'll go over that and talk about what's happening in your body when you're stretched too thin, how hormones, sleep, and stress play a role in all of these things, and boundaries, what's really happening inside your body when you're constantly in go mode all the time. And again, because October is also breast cancer awareness, in the lab, we're going to unpack the physiology of resilience, how cortisol, recovery, and estrogen intersect, along with the newest research in hormone therapy in breast cancer survivors, a topic that deserves clarity, compassion, and evidence. So grab your coffee, your notebook, your tea, and let's dive in. All right, so if I'm being honest, I'm still a little tired, and that's okay. The last few weeks have been a complete whirlwind. Traveling, webinars, speaking, patients, new patients, family, sports. And now that I'm finally home, I'm doing my best to be fully present with my family while still keeping the practice running, still building a practice and growing and working full time in another practice. It's this push and pull that every founder understands. What you're building, you're deeply grateful for it, but sometimes you're just plain exhausted. And parents also showing up, and maybe you may have forgot that they were coming. So that was a thing. So the truth is, coming down from back-to-back events isn't easy. You spend days living out of a suitcase, running on adrenaline and conference coffee, connecting with hundreds of people, hundreds of incredible women and women in medicine and entrepreneurs. And then you come home to laundry, emails, and of course, a family that's missed you and wants you. And that reentry can be rough. I've learned that part of leadership is not pretending that you have boundless energy, because we don't, but knowing when you need to pause, to rest, and to recalibrate. Even in the middle of the exhaustion, there have been so many bright spots the past 2 weeks. Osteopathic Midlife Health welcomes several new amazing women into the practice, each with her own journey, her own story, and her own version of what thriving in midlife means. I'm honestly continually inspired by the courage it takes for women to advocate for themselves, to say something isn't right and I deserve to feel better. And those are the moments that remind me why this work matters. At the same time, I've been growing in a different direction too, learning what it means to be a speaker, a teacher, and an advocate in this space. So I had the honor of joining several names in this space over the last few weeks. The Nurse Coach Duo, the YouTube just came out. We had such a great, honest conversation about hormones, perimenopause, and the reality of women's health. Then I was on the Fuchsia Tent, and we did that webinar. And Casey Fleming is just amazing. And she is such a great speaker, women advocate, especially women in the workplace. And then, of course, the Menopause with just some of my amazing friends and colleagues. And it really was just an incredible event. It's really amazing how these platforms can amplify our message. And every time I have the opportunity to educate, to explain what's really happening in midlife, to debunk all of the crazy myths that are still out there, and to help a woman feel seen, that's where I feel the most alive, knowing that all of my tireless energy is going in for something just amazing. But here's the other side of it. Social media isn't always kind, right? So for every meaningful exchange or thank you message, there often can be nasty comments or someone who just wants to stir things up, right? So there a lot in this social media space. There's so many clinicians telling you like, this is the right way to do it. And this is the right way to do it. And if you do it this way, it's wrong. Listen, we have several guidelines and clinical evidence and informed evidence, and we treat blood pressure several different ways, just like we can treat menopause in several different ways, just like we can treat weight loss in several different ways. So it's confusing for us who are on social media. So I can only imagine how confusing it can be for women in watching and getting educated in social media when they're influencers, whether they be clinicians or non-clinicians, saying, this is the way that you need to do it. And if you don't do it this way, everyone else is wrong. Listen, it is the art of medicine. We don't have to do it the same way. There's several different ways to do many, take care of women in many different ways. So I've learned to try to not take it personally, but I'd be lying if I'd say it never stings to see these things. But when you put your voice out there, especially as a woman physician in midlife and menopause space, a woman clinician, it doesn't have to be just doctors, MPs, PAs. You open yourself up to criticism. And sometimes it comes from other clinicians, which can make it even harder. So we all need to remind ourselves the goal isn't to please everyone. The goal is to teach truthfully. I have been doing this for a very long time. I have an amazing community of patients, and I need to remember that my voice is there for them. So we need to make sure that, we're teaching truthfully, compassionately, and evidence-based and evidence-informed. This is a really great concept, and I cannot take any credit for that, but a friend of mine, a colleague of mine, evidence-informed. We don't always have evidence-based guidelines for everything, but we take the evidence, we inform our patients about the different options, whether they be FDA approved or not FDA approved, off label. We use medications all the time off label, and have open and honest communications. So that's what leadership looks like, staying grounded even when the online noise gets loud. And another big lesson this season, I need to start batching all my ideas. Like, this is so big, whether it's newsletters, emails, blogs, social posts, creating them in advance in focus bursts, because doing everything last minute is 100% not sustainable for me. I love helping my social media manager and my brand manager create content. And sometimes she's like, leave it all alone, let me do it. But I am just the type, I have to have my hand in it. Whether, and I've met other people that are the same way. Just a little hand, a pinky or a ring finger. I need to have in there. And I love connecting, but when I'm constantly producing under pressure, that I have realized is definitely a burnout for me. Like, I can only do so much in so little time. And I work much better when I have time to sit down and kind of take that time to get everything done, whether it's 4 emails, 4 podcast ideas. That's where my sweet spot is. Some can do it on the fly and be perfectly fine. I've learned this about myself. So a few hours of focused creativity can buy me weeks of breathing room, and it lets me show up more consistently, and probably more consistently at home. I still thrive fine in my work environment, but it's my home space that I'm finding I'm more irritable with family, and I really just need to find more joy. And I think that consistency is. So if you're a founder or a busy professional listening to this, you probably get it. You want to do it all, and often you can do it all, but just not all at once. So the question becomes, what can you do alone and what can you afford to delegate? And sometimes that is very difficult, especially when you're first starting your practice. You may only be able to afford to delegate so much or so little. So really just making sure that you delegate the time and your expenses and really find out where your sweet spot is. And that will change as you grow. So this is a founder's dilemma in its purest form. We build something because we have this amazing vision. And then as it grows, we realize we cannot sustain it solo. But bringing in help takes trust, resources, and often a leap of faith. And I'm right in that stage, figuring out what needs my hands on it and what can be handed off so I can focus on what matters most, which are growing my practice, patient care, speaking, educating, and meaningful connection, and being present at home. Some days I nail it, and other days I'm juggling too many plates. But what I'm learning is this: balance isn't a finish line, but it's a rhythm. It shifts with each session, each opportunity, and each new patient who walks through that door. So today's journal entry isn't polished or perfect. It's just honest. I'm tired but proud, and stretched but grateful. So learning to work smarter, to protect my energy, and to trust that everything doesn't need to be done right this second. If you're feeling that same sense of overwhelm, the weight of being of everything to everyone, let me tell you this: you're not alone. You need to pause, you need to breathe, get clear on what fuels you and what drains you, and then one step at a time, start building systems that support you. Because the truth is, burnout doesn't happen because we don't care. It happens because we care too much and forget to refill the tank. So as I move through this season, I'm setting an intention to create with more foresight, to delegate with confidence, and to rest without guilt. And the mission of Osteopathic Midlife Health continues to grow, and so do I. So ask yourself a couple questions. Number one, what part of your work or your life still lights you up? Not just what are you good at, but what feels alive. And when you're doing it, time disappears. You feel rooted, even if it's hard work. That is alignment. Question number two, what feels heavy? The kind of heavy that isn't good tired, but soul tired. For me, this was overcommitting to administrative tasks that pulled me away from patient connection. I love growth, but not at the cost of joy. And question three, what needs to evolve? Not be abandoned, but refined. Sometimes it's a system, sometimes it's a mindset. And this year, I realized that how I was managing my schedule no longer fit the volume of patients we were serving. The structure that once gave me freedom had started to create friction. So evolution for me looked like rebuilding workflows, not as a sign of failure, but as a proof of growth. And question number four, what am I doing out of fear instead of trust? That one's uncomfortable because fear hides in logic. It sounds like I can't delegate that yet, or I need to do it myself to make sure it's right. But fear keeps you stuck at your current level. And trust, that's what allows expansion. And question five, what can I simplify before the new year? Because evolution isn't about adding more, it's about subtracting what no longer serves you and the next version of you. So this practice started as an idea in my notebook. It's grown into a thriving community of patients, conversations, and change. And as it expands, I find myself constantly asking, how do I want this to feel next year? Do I want more structure or more freedom? More visibility or more intimacy? More education or more rest? The point of reflection isn't to judge where you are, it's to understand it. That's how evolution begins. So as you move through this quarter, I hope you take time to pause, to audit, to reimagine, because the next version of you deserves intention, not default. It's a long journal, but that was my founder's journal for this week, a snapshot of the messy, beautiful middle of building something that matters. Now let's shift into the midlife minute, because this conversation about balance and burnout doesn't just apply to business. It also is a deep physiological reality for women in midlife. So let's start with what's actually happening in your body when you feel burnout. Burnout isn't just being tired. It's a full body stress response. And chronic stress keeps your hypothalamic pituitary adrenal axis, I know it's long, HPA axis, switched on. That's the system responsible for producing cortisol, which is your main stress hormone. And over time, constant activation of that system leads to what is known as allostatic load, the wear and tear on your body from chronic stress. And that's why many women in perimenopause notice new anxiety, irritability, fatigue, or that wired but tired feeling. So for example, postmenopausal women receiving estradiol therapy exhibit reduced cortisol responses to stress and less impairment in working memory under stress. Burnout in this stage of life isn't a sign of weakness. It's a physiological state amplified by hormonal change. So how do we start reversing that? Or how do we fix it? Here are a few evidence-based practical steps. Number one, prioritize restorative sleep. Sleep is the single most important reset for your HPA axis. You need to aim for consistency, the same bedtime, the same wake time, a dark, cool room. If you're struggling with night sweats or insomnia, make sure that you're talking to your clinician about treatment options, including hormone therapy, magnesium glycinate, or cognitive behavioral changes for sleep. Number two, make sure you build boundaries like they are medicine. Say no more often. I often will tell my clients, here's your no card. If you can't say it, show it. Say no more often and protect your energy like it is your prescription. Research shows that perceived control over your time directly lowers burnout risk. And boundaries aren't selfish. They're physiologic protection. Number three, move your body, but don't overdo it. In midlife, more isn't always better, and chronic overexercising without recovery can spike cortisol even more. Focus on strength training, mobility, and moderate intensity movements that feel energizing but not depleting. And number four, eat for stability, not restriction. Fluctuating blood sugar worsens cortisol spikes. So build meals with protein, fiber, and healthy fats. And don't forget your hydration. Dehydration alone can trigger fatigue and brain fog. And finally, number 5, consider hormone support if appropriate. So if perimenopausal and menopausal symptoms are adding to stress, make sure that you're talking to a certified menopause practitioner about hormonal and non-hormonal options. Restoring estrogen and progesterone balance can improve sleep, cognition, and your resilience to stress. And finally, give yourself permission to rest without guilt. Productivity isn't the measure of your worth. You can't pour from an empty cup, and you don't need to apologize for needing a refill. So that takeaway is burnout is not a character flaw. It's a body signal. The goal isn't to push through, it's to listen, adjust, and rebuild your rhythm. So if you've been running on empty, this is your sign to pause. And maybe that means taking a day off, or maybe it means turning your phone off for an evening, or maybe just saying no or your no card for a commitment. Your body is wiser than your to-do list. Make sure that you listen to it. So before we head into the lab, I want to take a moment for something important and something global. October 18th is World Menopause Awareness Day, and I love that it exists, not as a marketing hook, but as a movement, because awareness is how we shift culture. It's how we turn silence into science, stigma into strategy, and confusion into community. So every October, I think about the women who are still sitting in exam rooms being told, well, that's just menopause. What's wrong with menopause? There's nothing we can do. And I think about the women who never got that far, who were too embarrassed, too unsure, too exhausted to act, are those before us who are taken off of their World Menopause Awareness Day is for them. It's for all of us who are rewriting the story. And this year's theme from the International Menopause Society is cognition and mood, which I find so fitting because brain fog, anxiety, mood shifts, these are often the symptoms that make women feel like they're losing themselves. But you're not losing yourself. Your brain is recalibrating. Estrogen interacts with serotonin, dopamine, and neural pathways that influence everything from memory to motivation. And when those levels fluctuate, you absolutely feel it. So you're not imagining it and you're not overreacting, and you are definitely not alone. This is why we do this work, not just to treat the symptoms, but to bring women back into their own story. So if you hear this episode around October 18th, I want to invite you to do one thing. Talk about it. Post, text a friend, bring it up at lunch, start the conversation at work. Because every time a woman speaks openly about menopause, the world becomes a little safer, a little more informed, and a little more humane. Because that is what awareness actually is. It's advocacy disguised as a conversation. Okay, let's get scientific. And let's talk about what's happening inside the body and how you can work with your doctors to create real evidence-based change. This is in the lab. As we wrap up this month, I want to bring 2 conversations together: the physiology of resilience, how your hormones and stress systems actually recover, and the latest science around hormone therapy in women with a history of breast cancer. We know that October is also Breast Cancer Awareness Month. So let's start with resilience. Resilience isn't about never breaking down. It's about how quickly your body returns to baseline after stress. And the key players here are cortisol, estrogen, and your nervous system's ability to shift from fight or flight and then back into rest and repair. And when estrogen is stable and sufficient, it helps your brain modulate cortisol. It calms overactive stress circuits, enhances serotonin signaling, and improves your body's capacity to recover. But when estrogen fluctuates or declines, as it does in perimenopause and then into the menopause transition, your cortisol curve can become dysregulated. That's why midlife women can feel both exhausted and wired at the same time. The resilience system isn't broken, but it's overworked and undersupported. Allostatic load is influenced by environmental and genetic factors, but environmental stressors, such as adverse childhood experiences, social determinants of health, and discrimination, play this predominant role. And when you combine that with the hormonal changes of perimenopause and menopause, declining estrogen, shifting progesterone, testosterone, and fluctuating cortisol, it exacerbates the disruption. That estradiol supports this stress resilience by regulating cortisol, maintaining serotonin, and a dopamine balance. Those are your feel-good hormones, with optimal side effects seen at these physiological hormone levels. So when they drop, that buffering system weakens and your stress response becomes louder, faster, and more prolonged. Again, as we talked about how estradiol works, it modulates serotonin and the dopamine system, where it enhances serotonin, both the synthesis and the release of it, and it reduces the reuptake of it. And estradiol also influences those dopamine pathways as well. Those are involved in mood and your reward processing. So let's connect this to Breast Cancer Awareness Month, because for many women who've had breast cancer, conversation about hormones and resilience can feel especially fraught. Here's what the research says and what every woman deserves to know. According to the American Cancer Society, we know that 1 in 8 women in the US over her lifetime, not 1 in 8 women, but 1 in 8 women over the course of their lifetime will develop breast cancer. 75% of these cases happen after 50, meaning menopause and oncology often coexist. And according to a 2023 study in the Journal of Clinical Oncology, up to 80% of breast cancer survivors experience menopausal symptoms, yet only 25% receive appropriate treatment. It may even be less than that. Let's let that sink in. 4 out of 5 women experience symptoms, and only 1 in 4 gets help. That's not a medical gap, but a failure in the system. So how do we fix it? It really does start with collaboration. So if you've had breast cancer or are caring for someone who has, here's how to bring medical teams together. Number 1, you need to loop everyone in. Ask your oncologist and menopause clinician to communicate directly. There are often pre-vivership menopause practitioners, meaning that if you are at higher risk for breast cancer, you can actually go and see a menopause specialist or see a menopause specialist when the diagnosis occurs, especially if they're going to put you into menopause. You'd be surprised at how often they want to, but the system doesn't make it easy, or they're not educated like many practitioners. But sometimes a simple patient-signed release can start that conversation. Number 2, track your symptoms. Make sure you're documenting frequently and how the frequency and duration impact your life, your sleep, your intimacy, your cognition, your relationships. Data gives your doctors leverage to advocate for you. And explore your options beyond estrogen. There are non-hormonal therapies, SSRIs, gabapentin, fezolinetant or Veozah. These can reduce hot flashes and night sweats up to 60%. Cognitive behavioral therapy has also shown effectiveness in improving sleep and anxiety during survivorship. Make sure you prioritize your bone and heart health. We know that cancer treatment and estrogen loss both accelerate bone density and decline cardiovascular risk. Regular bone density scans or DEXA scans, resistance training, and adequate calcium and vitamin D are not optional. They are foundational. Make sure that you revisit your care plan regularly. So as your body changes, your needs evolve, and your care should too. The new expert consensus from the Menopause Society, the Menopause Journal, reviewed all the current data on menopause hormone therapy, both vaginal and systemic, in women with a history of breast cancer. And here's what they found, and it's worth repeating loudly. Menopause care after breast cancer should never be a one-size-fits-all. It's very nuanced. So let's quickly break that down. Individualized care is essential. No 2 women and no 2 cancers are the same. And decisions about hormone therapy depend on cancer type, time since diagnosis, menopausal symptoms, bone and heart risk, and personal quality of life priorities. Shared decision-making with both a menopause specialist and your oncologist is key. Number 2, we know that vaginal estrogen and DHEA are safe options. For the genital urinary symptoms, vaginal dryness, pain with intimacy, urinary frequency, we know that low-dose vaginal estrogen or DHEA can be used safely when non-hormonal options fail. Recent JAMA Oncology and Obstetrics and Gynecology studies show no clear increase in recurrence or mortality even in women on endocrine therapy. Number 3, systemic hormone therapy requires nuance. So for women with ER negative, ER/PR negative, or triple negative disease, recurrence risk from systemic menopausal hormone therapy appears minimal, though remember, evidence is limited. For ER-positive disease, we know that estrogen generally should be avoided according to the consensus unless symptoms are debilitating, and oncology agrees to a carefully monitored trial. Again, this is very nuanced. It takes a very close risk-benefit, nuanced approach to every woman. Number 4, body-identical hormones appear safer. Transdermal estradiol combined with micronized progesterone shows a more favorable breast tissue profile compared to older synthetic formulations, along with lower clot and stroke risks. And number 5, testosterone shows promise. Low-dose testosterone may improve libido and sexual function without increasing recurrence risk, though the data remain early. Whether or not hormone therapy is appropriate for you, there are ways to support your body's recovery systems. Adequate sleep, strength training, nutrition, emotional regulation through mindfulness or therapy all enhance cortisol balance and your cellular repair. And for survivors who can't use hormones, there are still powerful non-hormonal options for hot flashes and therapies for the genital urinary syndrome and menopause. The message here is one of empowerment through evidence. You deserve options, you deserve clarity, and you deserve a care plan that honors both your past and your future. Resilience isn't about perfection, it's about adaptation. And every time you learn something new about your body, advocate for yourself or reclaim a piece of your well-being. You're already winning that battle. So that's today's episode of the Founder Series. We walk through what it means to be overwhelmed and still grateful, how burnout and hormones intersect, and how the latest science continues to reshape what we know about hormone therapy. Even for women who survive breast cancer, if this resonated with you, share it with someone who needs it. These conversations move the needle toward better care, better awareness, and more compassionate medicine. So as we close out today's episode, I want to bring it back to where we started. Evolution. In business, in health, in identity, evolution isn't about burning everything down and starting over. It's about refining what's already here. It's about making space for something new while honoring the foundation that got you here. Whether you're running a practice, rebuilding your health, or just trying to stay grounded in this wild world, remember you're allowed to evolve, you're allowed to grow differently than before, and you're allowed to design a version of your life that feels like you. So if this episode resonated, share it with someone you love, subscribe wherever you listen, and follow along on Instagram and YouTube.